Thank you very much for the kind introduction, Shasa. I also wish to thank Dr. Raji Menon and Fahima Hassan and Elizabeth Mamin and Dr. Deepu Sudhakaran and all the other officers of AKMG. And thanks for Manasanthi for giving me this opportunity to talk about it. We are talking about physician burnout today. This topic about wellness of the physicians is receiving wider attention now. More and more medical organizations and state boards are recognizing this as an important issue. In a couple of weeks, I'm attending American College of Surgeons 3-day convention, and in that 3 sessions are specifically being devoted to this one particular issue about physician wellness and physicians' mental health and burnout. And unless the doctor is in good health and unless the doctor is having a good mental state, he cannot provide the care. And when the doctors are burned out, it's a tremendous loss for the society and for the family. So the support systems and CMEs are being arranged all across different parts, and even some regulatory bodies and state boards are considering requiring an hour or two of physician wellness as part of the licensing requirement. So this is an important topic, and we are having an opportunity to discuss about it. I will run through the slides fairly quickly because we lost about 10 minutes of our time. It's not moving for, yeah, okay. The overview is what is physician burnout, examples of some real cases, and the reasons for burnout, and after effects of stress on the physician, what the physician feels and experiences, and some of the solutions and recommendations. Okay, what is physician burnout? How do I get this small minimize? Okay. It's a physician burnout is an emotional exhaustion, the feeling of being drained and fatigued, and the physician feels overwhelmed, and then he or she becomes depersonalized. They develop a cynical attitude towards patients, and they start treating them as objects or entities. So there is a reduced personal efficiency to follow that, and there is a feeling of being unaccomplished or being ineffective, and they start questioning the value of their own work, and they feel that they are not useful anymore. And that leads to disenchantment, depression, anxiety, and then substance abuse, suicidal ideations, and leads to further medical errors. And overall, it leads to lower patient satisfaction. It's not moving. Okay. About 50% of the physicians are burned out. The statistics show that they are burned out by the age 50. This high level of stress is compared to other jobs, and this results in early retirement and results in transfer to non-clinical work and results in stress-related after effects. This is a tremendous loss for the society.
You have to tell when you have to move the slide.
Okay, that's good. Okay, then that's good. I can say that. The common theme for all the doctors is a deep love for medicine. They love the fact that they can take care of patients, but they are afraid of fear of career damage. They are afraid of stigma, and there is a lead that leads to profound isolation and negative reactions. Next slide, please. About this, the mental health issues are not unique to doctors alone. It affects a lot of people. Only thing is there is more of mental health problems for the physicians in there compared to general population. If you take the general population, 60% of Americans are lonely. The Statistics show there's a national lifeline 988 for mental health crisis or suicidal ideations. They received 5.3 million calls or texts in last 1 year. So that tells you the magnitude of mental health issues in all across the country. 1 out of 5 teenagers report anxiety and depression. The statistics also show that every single day, one physician is committing suicide in United States. Total about between 350 to 400 physicians commit suicide every year. Next slide, please. So if you see some of the actual instances, these are true stories of certain physicians. Pamela Weibel in Oregon, she says she has written a lot about this topic. We enter medicine to care, help, and heal. We are trained to suffer in silence. That's our problem. The silence can be deadly. She was a family physician who was burned out severely and then turned into an activist and runs a physician suicide hotline. She has had 1,300 physician suicide stories in her records at this point. Next slide, please. There's another physician who got burned out was Lorna Breen. She was a New York Presbyterian Hospital ER physician. During COVID-19, she got so overwhelmed and it took an emotional toll and contracted COVID by herself. Then she committed suicide in April 2020. Following this, a bill was passed in the Congress, which led to the Lorna Breen Healthcare Provider Protection Act signed into law in 2022. This program supports mental health among healthcare professionals. Next slide, please. Carrie Cunningham is a very well-known person. This is a true story. She's a Harvard associate professor. She, like many physicians, they are overachievers. The overachievers externally, they feel that they can do everything. She was a tennis champion. She played in US Open. I have a tennis colleague. She came from Stanford and she feels she should be winning in the tennis court also. She tells me, you're a doctor, you should be able to win this game. That's not our constitution, but we are thinking that externally we have to be accomplishing and we have to be overperforming, overachievers. That's our attitude. So the physician, she was a physician Ivy League. She was married to another physician. She was chair of Association of Academic Physicians. But internally, she was suffering with depression, drug addiction, and her one of her best friends committed suicide. She became a divorcee, had a miscarriage. And because of all these issues, she went for analysis and she was found to be unfit to practice. Afterwards, she went through therapy and recovery and she's back on track. And this is a story where she came back out of the depression. Next slide, please. This article appeared only 2 months ago in Wall Street Journal. Suicide reverberates among young doctors. They're giving a story of various physicians who had suicidal ideations. Next slide, please. Okay, when physicians are committing suicide, the fact is, the truth is that doctors are twice at risk to commit suicide compared to general population, as this is reported in JAMA. Female physicians are at higher risk to attempt or commit suicide compared to male physicians. 9% of all male physicians and 11% of female physicians have reported suicidal ideations, according to 2023 report in Medscape. As I said earlier, every day one physician takes his own life or her own life in USA. Only the fact is also only less than a third of them ever received mental health care during the previous years. Next slide, please. When a physician commits suicide, The matter is often hushed up. Nobody talks about it. The facts are never revealed. The obituary column will not mention the cause of death. They often do not seek help. That's our problem. Physicians think that they can heal themselves. Drug overdose and gunshot wounds are the frequent modes of committing suicide. Next slide, please. There are several true stories of physician suicide in my personal knowledge, in my community and other people in other communities that I know of. A vascular surgeon cut his own femoral artery sitting in a public park. A plastic surgeon shot himself sitting in the office chair. Gynecologist hung herself at home. Neurosurgeon shot himself at home. ICU pulmonologist actively working died at home from drug overdose. Next slide, please. So this is not unique to US also. It's happened in India. These are all reports in the last 3 or 4 months' time. This doctor these are suicide reports from India. Popular neurosurgeon shot himself. Siddharth, a popular dermatologist, committed suicide at home. These are all in this year. Gynecologist died after postpartum hemorrhage that led to official inquiry, and they thought it was an incompetence. Next slide, please. So, in addition to committing suicide, physicians have been murdered also because of the patient dissatisfaction. Everybody knows that President George Bush and his cardiologist was walking, and a guy came and shot the cardiologist. The Kerala lady physician was stabbed in the emergency room. In my neighborhood, a nephrologist was shot and killed. Whenever a patient feels cheated and there is no legal recourse, they take the law in their own hands. Next slide, please. Patients have attacked doctors many times, and particularly in India, when a patient dies, the doctor runs away from the scene because you don't know what's going to happen. More common in Eastern societies. They feel that they were ignored or neglected, and feeling that the system protects the doctors. They also treat mentally insane patients. So the first reaction is to hide from injuries, errors, and death. Next slide, please. There are also physicians have committed murders. Also, they're on the other side. There have been several stories where physicians tried to kill their wife or husband and things like that. That has happened also because of emotional overreaction. Next slide, please. So what are the reasons for the burnout? We know that there's going to be burnout. There's emotional distress for many physicians. The reasons are mostly related to stress. The stress is in workplace, stress is in their personal life, stress is at home, and the tension builds up internally and it bursts out like a volcanic eruption. There is a conflict between their moral consciousness and sensitivity and with facts and factors that are happening in real life. Next slide, please. So there are specific reasons beyond this, inside of this general statement. The specific reasons are what are the specific reasons for them to get burned out? Too much workload, first of all. There's excess workload. They take it upon themselves or it's being thrust on them. There is a lack of job satisfaction after some time and lack of respect. High malpractice premium is a big issue. I was looking up about the medical errors talk I'm going to give pretty soon. And in Miami, the OBGYN pays $200,000 a year premium. It's out of control. The physicians have lost control of what's going to happen to the patients because now over 90% of the doctors are employed or salaried by somebody else. Electronic medical records have caused also a problem. The technology is rapidly changing. What was being done by open incision, it became laparoscopic. Now it's all becoming robotic. So every 10 years you have to relearn yourself, and the competition is intense. On top of it, there is fragmentation of healthcare. Next slide, please. There is immense pressure at work. It's because of the patient expectations and the regulatory situations. No mistakes are allowed. You cannot make a mistake. It's not possible to have 100% accuracy in your job. Any industry for that matter, whether it's somebody is putting the roof on, tiles on your roof, or making a car or a tire, there's going to be some errors. But it's in the human life, in the physician's life, it is not allowed. And it has become more and more common for the physicians being overviewed and overseen by non-physician healthcare workers. After 20 years of training and experience, I'm being told by the nurse who had only 2 years of training as to what I'm doing right or wrong. The hours of work need to stay current. It keeps changing. The technology keeps changing. New drugs are being brought in. Protocols are being changed, and what you learned 4 years ago is not valid anymore today. So the younger doctors are taking over the older ones, and the older ones feel that they are being left out. There is a lack of time control. Uh, you have about 30 minutes to see a new patient and 15 minutes to follow up visits. So that allows you only 10 follow-up, 10 patients in 4 hour shift, but the employer wants you to see 20 patients in every 4 hour shift. So that leaves you with a requirement to write all your notes and filling digital charts after hours. Next slide, please. The doctor-patient interaction is also going down because of the computer system. There is less face-to-face conversation. Doctor is looking at the computer, nurses are looking at the computer, everybody is looking at the computer, and instead of looking at the face, when you call for an appointment, first question is not what's your name or what's your problem, what's your insurance. That's the way the system works now. Next slide, please. Next slide, please.
Change already. It's a new slide.
It's not coming here.
What does it say in the top?
Talking Venkit Iyer. Time control. Oh, okay, now you came. Admin. Yeah, that's good. That's all right. You can leave it like that. Administrative tasks, political overplay into medical practice, reimbursement is a big issue, and insurance and appeals and resubmissions. All this takes a lot of time and energy out of the physicians. On top of it, the doctor has the type A behavior, and he or she is seeking for perfectionism. They don't want to accept the issues, and the stigma of accepting stress is also there. And meeting a financial goal is another issue. Next slide, please. There's isolation in the workplace, isolation in the circle of society, self-imposed deadlines. They do multitasking, overbooking the schedules, and they go to multiple facilities to do the work. So there is time spent on driving and transportation. Family issues is another big part of it. They don't have enough time to spend with wife and children because they are overwhelmed with work. Next slide, please. So the errors are going to happen. So they take it as if it is their own fault. They feel personally guilty for the errors that happen. It's going to happen. That's part of life. There's inability to overcome the mistakes and move on. So the parade of patient errors slips during the sleep. It comes through your dreams. The overhead of the office expenses, office staff issues, surgery assistant issues, reputation issues, all of these add to the problem. And as I said, they don't have enough time to spend with a growing child or spouse. That's another problem. Next slide, please. Financial concerns is a big issue. It's what we call as the golden handcuff. The physician is already 10 years behind compared to other jobs, other professions. And he already has a $200,000 debt when finishing medical school. So there is a heavy tuition and boarding expense and decreasing insurance reimbursement. So they want to recoup all that money as soon as possible. This leads to a lot of questionable acts and behaviors. Next slide, please. So as I said, you spent 4 years in college, 4 years in medical school. There was an article in the Wall Street Journal last week. It says 20-year-olds coming out of college with experience and training in artificial intelligence are being offered $300,000 to $1 million salary. And now you look at that with the physician who has spent 15, 20 years of training, and he's starting with a $60,000, $80,000 salary. Next slide, please. So the plight of general surgeons is the worst of all the specialties. The lowest reimbursement, highest level of stress. So almost all the general surgeons are no longer in private practice. Next slide, please. The average reimbursement for lab chole is down today compared to what it was 2013. The medical malpractice premium has gone up. According to one article I read recently, in Florida, first 140 lab choles goes towards paying the malpractice premium every year. So the inflation-adjusted reimbursement for 20 common general surgery procedures is down by 25% in the last 25 years. So that next slide, please. Money is not in the medical profession. The doctors who are practicing are not wealthy. They are well off. They are upper middle class, but they are not wealthy. Wealth is with private business. So money is less in the medical profession. They look at everybody and say, "Oh, I have to be like that." So that's what leads to another part of the stress. Next slide, please. The physician's attitude is that they want to look strong and they want to think that they know everything. They want to be in control. They want to be leaders. They become aggressive and risk takers. However, internally, they feel insecure and fearful. So there is lack of help and refusal to get help. So the conflict is between body, mind, and spirit that leads to further misery. Next slide, please. Patient dissatisfaction is due to various factors, as I mentioned. We already talked about these things. Next slide, please. He feels like a cog in the wheel that is spinning out of control. Feels like working for some agency, not for himself. The individuality and personality are marginalized. The freedom of professional and personal life is curtailed. And there is loss of incentive for putting in more time or more effort. So since he has to follow protocol, so there is a loss of motivation and loss of innovation or experimental work. Next slide, please. Personally, myself, I also felt a lot of stress in my work. It's difficult to get proper assistance. In private practice, it's hard to get somebody to help you. It's very expensive and it takes a lot of effort to keep the good help. You are always bumped on starting time, except for the first case of the day. You never know. The nurses change middle of the case, and the completely new person comes in because it's time for their break, coffee break, and things like that. Delay and silly protocols. Everyone knows better than you as to what is being done and what needs to be done. And next slide, please. Medical errors are going to happen. It is part of life. As I said, physicians tend to blame themselves. As one person said, the only way to avoid complication is not to operate. Um, when you are young, you have inexperience and lack of mentors. When you're old, no one wants to correct you. So both ends of the spectrum, you have higher number of errors and complications. Next slide, please. Death of a patient is considered as a failure by doctors and the healthcare profession as a whole. It's not a failure, but it's a natural thing. But death is considered as a failure. So it leads to emotional reaction by the family and friends. The entire healthcare is focused on saving life and keeping the patient alive, even if it's for another day, another few hours. So very little training is in the curriculum to face death. So keep trying everything possible. That's our motto. Next slide, please. Gender is also an issue. More women are entering medical school than before as a whole. More men are opting out of medical field. And women are also equally concerned about their lifestyle and family, and they tend to work minimal number of hours. This is a loss for the society also. Next slide, please. Women have worse problem and worse plight in surgery when they are entering in the surgical field. Is first of all, it's hard life and lot of work, and then they have to balance their family life and household work and childbearing. So many of them get single or divorced. Next slide, please. There is a parental pressure on many uh, young kids to become doctors. There is an over glorification of admission to medical school by parents. If they just gloat that my son, my daughter, she joined this medical school, as if the other professions are not of no value. So it put pressure on many youngsters to join medical school, even if they have no passion for it. The mindset is more often seen in among the Indian community, and also when the parents are physicians, they expect their son or daughter to also to become doctors. This parental pressure puts the kid at a disadvantageous situation. Next slide, please. There are specialties with high stress. Those who do procedures and interventions are at higher risk. General surgery, followed by OBGYN, and all the interventional radiologists. The nurses and technicians have often better control than the highly trained physicians in real life. When you go into the real hospital practice. Next slide, please. So they end up opting for lower stress fields, which is dermatology, psychiatry, family medicine, administrative work, research, pathology, laboratory, and so forth. Next slide, please. There are specialties where there is no patient contact or direct relationship. Radiologists, pathologists, anesthesiologists, ER, intervention, they just do procedures. They are not taking care of the person, they are taking care of the problem. And it's a small intervention for a very limited period of time, and there's no approach or talking to the person before or after. It's just do the intervention and leave. That's it. Next slide, please. So this we are seeing as a new problem in the healthcare, which is fragmentation of healthcare. There's an impersonal intervention. Nobody is following um, throughout the course of the person's illness as it used to be in the Marcus Welby time. Everybody just does a small piece of the work and stay in their box and don't want to know what's happening afterwards. It's become fragmented as far as healthcare is concerned. You have the surgery has become acute surgery, shift surgery. It means just do work for 8 hours and leave. They don't want to know what happened to the patient. Hospitalists in the same way, They are in the hospital only. They don't want to know what's happening afterwards. Interventional radiology, pathology, and so forth. And many primary care physicians are also office-based. They don't want to be following the patients in the hospital anymore. Next slide, please. Robotics and Da Vinci equipment is promoted very heavily by the manufacturers. Hospitals are interested in market share. They have invested heavily. Each equipment costs $1 million. So they want to recoup the money. Physicians are in competition with each other. So the problem is it's a surgeon who is not used to robotics. Now he is forced to learn all the new techniques. Yes, it is necessary to keep up with the progress in technology. But as your rugs are being pulled out of your feet frequently, it takes a lot of pressure on the person to do the new way of doing it. So the problem is the youngsters take over, and the old ones, the senior ones, are unwanted by the society anymore. Oh, he doesn't do the robotics, so that means he's not a good surgeon anymore. So that builds up pressure on the surgeons. Next slide, please. Risk aversion, new technology, new equipment, new protocols, new drug therapies. The old surgeon or old physician says, we have done it this way always. But the young and adventurous are filling the gap. So the older ones, by the age of 50, you're feeling like you are getting left out. Next slide, please. So there are many other conditions in the healthcare system, many other problems with the healthcare system. They see it on a daily basis, but they are not able to do anything about it. They experience discomfort with the healthcare system, but are unable to do anything about it. Some of these items are like they see unnecessary surgery on a daily basis. They see medical errors. They see medical waste. They see marketing by the hospitals, unnecessary C-sections, overuse of antibiotics, lack of transparency. Next slide, please. Overtreatment of end-of-life issues. The dying patient is not allowed to die. Misleading screening procedures, a lot of unnecessary screening procedures, incentive for payment for procedures, not cognitive work, lack of support for cognitive, excess imaging studies, overdiagnosis of cancers. It is well documented that over 30% of all tests and treatments are unnecessary. There is defensive medicine. Next slide, please. Medical education does not address cause, practice issues, or humanitarian issues, communications, and medical errors. Medical training focuses on tests and procedures and overdiagnosis. Next slide, please. So all of this leads to the physician committing fraud and scams. It's not that they want to do it, but they see this being done all around, so they also want to do something to make money. So there is billing fraud, narcotic prescriptions, unnecessary procedures, kickbacks, fee splitting, ghost physicians. They're saying that I am there, but it's their assistant or somebody is doing it. Ghost patients, patients who are not there, but they document as if the patient is there, and the unlicensed practice. Next slide, please. There are many cases of physician making mistakes that I knew about. So physicians losing their license for Medicare fraud, pain management, and loss of license, and to going to another country to practice and things like that. I have seen that happen in my life. Okay, next slide, please. The more recently published, the last month or so, was the Baylor College of Medicine. They were conducting double surgery in 2 rooms, and they were billing as 2 separate surgeries, whereas the surgeon was only there for part of the procedure. The rest of it was being done by the residents. And there was a whistleblower, and the hospital had to make $15 million fine for that. Next slide, please. Mental health is and sex is also another issue. It's a poorly addressed issue. Sexual dysfunction can lead to mental stress. and a mental stress can also lead to sexual dysfunction. So both ways it can happen. In addition to that is the sexual harassment and gender identity issues and sex-related crimes. Next slide, please. All these effects, all these items that we discussed, that affects the physicians and adds to his stress. So numerous cases, what happens to this physician after he sustains or experiences all this so much stress? Many of them get divorced, and then nearly 80% of the physicians in my community has divorced at least once, and they become alcoholic and become drug addicts and become a dangerous situation with the greed and avarice on top of it, because they have to support the second family, third family, and so forth. Next slide, please. And this leads to depression, suicidal ideations, medical errors, drug addiction, alcoholism, divorce, anger, violence, and loss of reputation. Next slide, please. And leads to medical healthcare problems also: hypertension, diabetes, heart attack, stroke, neurological disorders, and accidents, and so forth. Next slide, please. Many physicians have died at younger age and at work, and because of the added factor of stress in their life. There was all these are news from the last 2 or 3 months. 38-year-old cardiac surgeon dying from cardiac arrest, and 42-year-old cardiologist dies from heart attack. One of my colleague surgeons died of hypertensive crisis the night before. Surgeon had an acute MI in the middle of surgery. So what happened? These doctors have been neglecting their own medical problems. Next slide, please. Sleep is an issue. It's a big recommendation for good health. Physicians have poor sleep, particularly those who do procedures. You are unable to sleep properly because of phone calls and emergencies. So that leads to multiple medical problems. Next slide, please. Eating disorder. As a surgeon, I was told, eat when you can and sleep when you can, because you never know when you will be able to. You will not know when you are going to be called. So we end up eating in the hospital cafeteria, and which is all ultra processed food, leads to obesity, diabetes, cardiac problems, lack of nourishment, and leads to metabolic syndrome. Many of the surgeons, after age 50, you will see them with a pot belly. Next slide, please. Anger and emotional overreaction happens, and volcanic eruptions. They throw the instruments and some verbal abuse and so forth. Next slide, please. They end up drinking alcohol. Next slide, please. Or some of them have taken to drugs and cannabis and marijuana. Next slide, please. Or many of them smoke cigarettes. Between cases, hiding behind the bathroom, they smoke. Next slide, please. Divorce is the tension in the personal life. Priorities are different for different members of the family. There is no common grounds and lack of time, non-availability. The children say, "Where were you when I was growing up?" So there is a conflict between personal life and work, professional life. Next slide, please. There is a gender divide in the society, and it's also adding to the problem. Women are becoming more independent and smarter. There's less romance and marriage in the society. There is less fertility and childbirth, and the old school of women being homebound is no longer true. So there is increasing digital solitude, which is another issue. So social media is another issue. Next slide, please. This is an article from Wall Street Journal about 2 weeks ago. Stress, overwork, and loneliness. Americans are having less sex than ever. More and more are remaining single, and that means more and more are becoming more lonely and having more stress in their life. Next slide, please. 60% of Americans are lonely, and 50% of 12th graders felt their lives were unworthy or useless. More and more children and adults are spending time on social media instead of going out, and that leads to digital solitude. Next slide, please. This digital overload is becoming a big problem, and many people have become starting to speak out against using social media. Next slide, please. You must have read about this teenager using ChatGPT to commit suicide in his house. This happened only a few weeks ago. Next slide, please. Human connection is very important. It's part of life and biology. From the moment of birth, baby wants to be held. Touch is one of the basic sensations. So instead of spending time on screen, looking at a cell phone or an image, you should be spending time with another person. Next slide, please. Impaired physician is another whole entity which has been discussed separately. Next slide, please. So the question comes out, who is providing the health care? Hospitals are not treating patients. They provide just a facility. Pharmaceuticals don't treat, they make drugs. Device manufacturers don't operate, they just make an equipment. Insurance companies just cover some of the costs. Nurses and paramedicals just follow the orders. So everything comes down to it went back to somewhere. Okay. Physician is providing the care and under pressure. Next slide, please. So why the doctors cannot get together? They are infighting among themselves. They become critics of each other. Doctors are their own worst enemies. They should be fighting against the external forces and work together. Next slide, please. So what are they fighting for? They are fighting for superiority, glory, academic titles, grants, overtime, block time, credentialing, jobs, turf war, call time, vacation time, medical staff positions, and so forth. It's all power, control, and money. Next slide, please. There is no representation for physicians as a whole. There are so many little associations, little organizations for each specialty, each group, but nobody is talking about the doctors as a whole. Next slide, please. The physicians are strong-willed and independent. They compete with each other rather than competing with others. The only profession that allows someone else to place a value on their service are the physicians. That third party stands to profit by setting low value on the work that is being provided. Next slide, please. So the problem with American healthcare system is it's too expensive, too many laws, too many rules and regulations, difficult in all across, unfriendly situation, in insurance and so forth. Next slide, please. So the new specialty in medical profession is the lifestyle medicine. It's a new branch. About 50% of the hospital admissions are due to lifestyle and behavioral issues. So instead of giving importance to tests and procedures that make money, we need to focus on the root cause, which is lifestyle issues. Next slide, please. The hope is the most important thing in life in order to keep going. You need to have hope that there is future, there are challenges, there is progress. When you are studying, you are hoping for good grades and admissions. When you are doing the medical school residency, you are hoping that you will get the right specialty and so forth. When you start your practice, you are hoping that you will have a level of income and reputation. But after some time, you feel that it's the same routine. There's no more hope. There's nothing more to be done. And it's the same routine and rut every day. Next slide, please. So what do the physicians love? They love patient care. They love good outcome. They want to meet challenges. They want to meet complex cases, intellectual activities. They want recognition. They want to talk to the patients and families. They want to be rewarded for the work. Next slide, please. When they retire early because of lack of enthusiasm anymore, it's a loss to the society. Many are on the prime of their health and they can prime of their life, and they can give many more years of good service or mentor other people. Next slide, please. So what are the solutions? Where do we go? They have to find passion in the work. They have to ignore income, preventive health care and checkups, avoid stigma of getting professional help, and switch to lower stress level fields. Don't go for the last dollar, and use networking and support groups. Next slide, please. And objectivity is needed to have good life. It's important to have a sense of purpose in life. If you need an objectivity and a goal, if you feel there is no enjoyment, it's not worth it. So pessimism sets in. When you wake up in the morning, if you have nothing to do, nothing to accomplish, it's like wasted day ahead of me, versus I have something to do next hour, next day, next week. I have something to look forward to. That objectivity is very important. Look forward to something coming up. Next slide, please. You can get into various hobbies: music, art, painting, writing, mentors, relaxation steps, sleep, diet, professional consultations. All of these are important avenues. Next slide, please. Relaxation strategies are there. Enjoy nature, sunrise, waterfront, parks, trees. These are all free. And take a break, slow down, stop multitasking, put down that cell phone, look at it only twice a day or something like that. Set realistic goals. Don't go for the moon. Your health is more important than somebody else's health. Next slide, please. Balance work with lifestyle. Family, children, grandchildren are very important. Friends and socialization is important. Hobbies, exercise well, struggle regularly. Take salaried positions without goal for making money for beyond a certain level. Group practices, fixed hours of work. Next slide, please. This is being recommended by different boards now. Credentialing and licensing should not ask about previous mental health problems or mental health issues. They should not be asking about prior psychiatric consultation. They should not be asking about prescription medications that they are taking. And the state boards have already instituted some of these reforms in many states boards. Next slide, please. What's coming up in the horizon is better recognition and awareness of physician wellness. Mental health of physician is getting more and more importance everywhere across. Several organizations are taking efforts to support this, and many are mandatory. Regulations are also in the wing. It's not yet out there. Next slide, please. Work hours were reduced from 80 hours to from 100 hours. It should be further reduced. More and more people are taking fellowship to compensate for that. You need time off for breaks and lunches and breakfast and bathroom and sleep and so forth. Next slide, please. Next slide. Yeah. Mentorship, professional coach, group interaction, peer support, and medications and professional therapy. Manasanthi is involved in one of these um, uh, as one of the avenues for you. Next slide, please. So my professor used to say, don't trust anyone, including your mother, when it comes to patient care. Do everything yourself. It is often your employees who will be the whistleblowers. The hospital employees could be the one to report you. So it's important to make sure that you're being nice to everybody. Next slide, please. So nobody is indispensable. We think that we are going to be irreplaceable. No. They will easily find another person to do the job that you're doing. If you work your heart out, they will just call you as a workaholic. Retire when your body and mind tells you to do so. Your patients will go to another doctor in no time. There is life after retirement, and don't retire from life. Engage mentally and physically. You may retire from work, but don't retire from life. Next slide, please. Life is involved with its own cycle. Reproduction, birth, survival, death are parts of nature. So there is no law in nature that says birth and death should take place in a hospital bed. Despite all progress, death cannot be avoided. So accepting end of life with grace and dignity is not a show of failure. Next slide, please. So you are more fortunate that 95% of the people in this world, look at what's happening in the rest of the world, Uganda or Gaza or Ukraine. You're lucky than anybody else. Look at all the good things that are they are compared to other people. You don't need more money than what you have. We have enough money. The good health is more important than wealth. Family and friends matter more as you grow older. So find peace and happiness with what you have. Next slide, please. There is this new book that was released. It's called Hope for the Cynics. Cynicism is a lack of faith in others. They are selfish and greedy. It can have a negative effect on you. When you feel that everybody else is bad, then you also may feel bad. So accept that the world is not perfect. It's not that all are bad. There is equally good and bad everywhere. So in order to ward off cynicism, check the facts, look at the positive events, spread positive tidbits, praise small little things, express yourself and talk. One small negative event becomes talk for the whole day or whole week, but hundreds of good things and positive events are happening every day around you and nobody even notices it. Next slide, please. So Manasanthi is involved with some of these activities. It's a great thing that they are doing. It's an AKMG activity. It's an opportunity to participate in group discussions and to discuss in private as well as in public in a group way. There's an opportunity to rewire and rejuvenate. It's not just one person's concern. It's a collective concern. Next slide, please. I stopped with this analogy, which I read about this recently. He is giving an analogy of boat floating safely in the water. He's comparing that the water all around you is chaos and confusion and bad news. And the boat is able to float as long as that water doesn't get into the boat. So what he's saying is, don't let the chaos and confusion and bad news come to your mind. You stay yourself in peace and you'll be able to float as long as possible. So that's the message he's saying. There's water all around, there's chaos all around. Don't let it come into your heart, into your boat. That's it. Next slide, please. That's my last slide. Thank you very much.